A high volume of visitors to the website for the health insurance exchange overloaded the site on opening day in Wyoming. The downside was that lots of people couldn't get access to the plans, but the surge of interest bodes well for those charged with getting word out about the online exchange. Cheyenne Regional Medical Center is taking the lead in providing people with the information and help they need to sign up. Exchange Navigator Tracy Brosius from the Wyoming Institute of Population Health spoke with us earlier to take some mystery out of the process. Tracy, what do you do as a navigator?
My major role and the role of the staff is to educate about the health insurance exchanges as we move forward under the healthcare law.
Now, are there some folks or groups of people who really don't need to be looking at the exchanges right now? Who are they?
Those folks who may already have what's called a qualified health plan, and which covers essential health benefits. So the folks on Medicare don't need to do anything differently. If you already have an employer-based insurance, your employer is taking care of that also. If you're already qualified for Medicaid. So our target audience is really those folks who have been previously uninsured or potentially have a self-insured policy that they want to reevaluate.
So what's the first step for those people?
First step is really you can get some education through us so that you can understand what questions to ask, or you can simply go to healthcare.gov and log on and create an account and look at what's available on the exchange.
The Wyoming premiums are some of the highest in the nation, but also there are subsidies, right?
Right.
How do those play into this?
So what happens is the system operates as both a shopping place for insurance, where the plans have been fully screened, but it also operates as an eligibility system. So you put in your household information and your income information, and so then that qualifies you, pre-qualifies you essentially for tax credits and what they're calling cost sharing reductions. So folks between 100% and 400% of federal poverty can qualify for some help with both premiums and your out-of-pocket expenses like deductibles and copays.
And actually, there are some people who don't earn enough money to qualify for the subsidies, so they're probably not going to sign up for a plan.
Correct. I would highly encourage anyone who is uninsured to go ahead and shop on the exchange, because we can flesh out whether you're Medicaid eligible and just aren't aware that you're Medicaid eligible. But since at this point Wyoming is still in a decision process about expanding Medicaid, those folks that are under 100% of federal poverty would be eligible for Medicaid, but they can still purchase insurance on the exchange, but they're not eligible for the credits and the subsidies.
In an earlier conversation, you mentioned this phrase, the young and invincible. What did you mean by that?
Well, that's a target market. Those are the folks who feel like I have a healthy lifestyle and I'm not sick, so I don't need insurance. So we call those the young and invincibles. But really, those are the folks that an insurance pool really wants to have because they are healthy. But an insurance for those folks really operates at a catastrophic. So if you break a leg or have something really unfortunate like appendicitis that nobody plans on, so that you don't end up with a huge financial bill because generally you're healthy, but you might have something happen that's just unexpected. So those are the folks we call the invincibles that we want to have join us too.
What are the important dates? What's the time frame?
Okay, so October 1st was like opening day of the season, but the next real important date is December 15th. So for those folks who log on and purchase insurance between now and December 15th, their insurance will go live January 1st of 2014. After December 15th, it becomes kind of a rolling calendar. So, then it becomes effective the first of the month after that they've enrolled. So somebody that signs up December 25th, their insurance will go live February 1st. The end date of open enrollment for this season is going to be March 31st with an effective date of May 1st. And so really we have a 6-month open enrollment season in this first year of the insurance exchange.
What would happen, for instance, if you've got a job right now, you have insurance through your employer, but, oh gosh, let's say next August, you're laid off. Does that mean you're not insured?
No, absolutely. So that's called a qualifying event. So folks need to just take a deep breath, because if you have a qualifying event, you can, at that point, because you've lost essentially your health insurance, you can go on to the exchange at that point and look for your options and purchase insurance, and or compare it against maybe your COBRA benefits if you're available.
I'm sure everyone is aware of the penalty or the fee if you do not sign up for a plan, but maybe instead of just throwing your money away at paying for the penalty, you actually put it towards some coverage.
So there are multiple ways and multiple people. We figure about 50% of our uninsured folks across Wyoming are going to qualify for some sort of a reduction and on the exchange. And so rather than paying that penalty, which in the first year is fairly low, but by year 2016 becomes quite substantial. So we're encouraging people to look at their options and to weigh those considerations, because the health insurance is really, again, can be that safety net, and you can find a plan that works for how you access your health care and hopefully fits within your budget.
We're getting a lot of confusing information, a lot of mixed messages coming out of Washington, Congress in particular. What's the best thing to do?
I think the best thing to do is to get some education. We're hosting access events across the state. So come out so that you can, we're providing some education on what is the exchange, how does it apply to you, what's it going to look like and feel like. And really the best advice is to come out and figure out what your options are before you make a decision based on something that you've heard, or even your neighbor's story of how they've experienced it.
And now again, you're a non-biased source of information, you can discuss the mechanics, but you don't have any position.
Right, so the Navigator's role is really to do that education all the way up to if a client comes and has some barriers, they're uncomfortable with the technology, that we can actually help them sit down and create their account, walk them through it so that they answer the questions, and then be able to find what their options are. At the point where the client or the consumer actually needs to make a choice about a plan is where the Navigator role ends. But we can help help you ask the right questions so that you get a plan that's going to meet your needs as how you access healthcare, plus hopefully fits in with your budget.
And how can people reach Navigators?
The best place is we have enrollwyo.org and then 211. So in Wyoming, and if you can pick up the phone and call 211, all the staff at 211 is trained as navigators, and they will have the calendar of where all the access events are going to be across the state, and they can help you get to us.
Tracy Brosius, you're from the Wyoming Institute of Population Health. Thanks for joining us today.
Thank you for having us.